Absolutely. So I just kind of told them like who you are, where you work, but I'll let you do your introduction however you want to. And so whenever you're
Awesome.
ready.
Okay. Yeah, so I'm going to do a quick introduction, then I'm going to pop up a PowerPoint. This is where I get a little awkward. I think I have it all set up and I think I've practiced, but I'm sure I'll screw it up somehow. I'm Amy Werner. I'm the Assistant Director of Business Development for Triangle Springs Behavioral Health Hospital. Have any of you heard of Triangle Springs? You have, okay. So I'll tell a little bit about that in the PowerPoint, but Triangle Springs has been here in the Triangle for a little over 2 years. We are an adult inpatient behavioral health hospital, and we also offer outpatient programming for both psychiatric and chemical dependency issues. So one of the wonderful things that I love about Triangle Springs, and primarily about my particular job with Triangle Springs, is that not only are we here to serve a need for more behavioral health beds in the Triangle and North Carolina at large, but we also are very determined to make this community a better place. So I have the wonderful job, primarily for our organization, of getting to do community outreach. So opportunities like this, I can do training to help educate folks, maybe take the mystery out of inpatient hospitalization, or help folks like you on the front line understand how do we get someone from crisis to assessment and possibly hospitalization. I also get to decide where some of our corporate funds go to support local organizations such as HopeLine. We do a lot of work with NAMI. There's soon going to be the first recovery high school here in Wake County. So we get to decide what organizations are we supporting, what events are we helping make happen, and then what can we do to bring information out to the community. So part of why I love working for Triangle Springs is we're a huge mission-driven organization that was started by social workers, has a social worker heart at its core. And while I'm not a social worker, I do love that I get to do not just marketing, but true community outreach. I've gotten to work with Lynn and everyone at HopeLine in a lot of different capacities over the last 2 years. Have developed wonderful relationships with them because they're unbelievable people to work with. And, you know, I just really am fortunate for that. So let me see if I can get, so can I share? So Lynn, do you have to give me permission to share my screen? Oh, nope, there we go.
Oh, yeah. You
Got it.
Then you pick your
I'm almost there.
PowerPoint.
What do you think? Did I do it?
Did it. Good job.
My young adult children would be so proud of me. I've been working on this forever. So one of the things that I don't know how, I can't see all of you, so I'm not gonna be able to see. I'm just gonna assume you're nodding at me or shaking your head when I ask questions, but well, maybe I can change it. Hold on. Yeah, that's a little better. So one of the things that happens when someone gets sick is there's a hesitation, whether it's a physical illness or mental illness, there's that hesitation now more than ever to go to the emergency room, right? That we believe that emergency rooms are COVID hotbeds and we want to literally avoid them like the plague. So now more than ever, nobody wants to go to the emergency room. But let's take COVID out of this. Our emergency rooms are really designed primarily for medical emergencies. Every emergency room across the state of North Carolina, and I would dare say the country, has some sort of behavioral health support. So there's either a social worker in the building or they have a relationship with a local behavioral health hospital or organization that helps them triage behavioral health crises as well. So it's not that you should never or cannot go to the emergency room when there is a behavioral health crisis, but unless there is a co-occurring medical emergency, those behavioral health crises get put on the back burner. So anything you may know about emergency room visits, they triage according to acuity. So if someone comes in having just been shot, having just gotten in a catastrophic car accident, having just had a heart attack, they're going to take precedence over the person who is dehydrated because they've been vomiting for days, someone who broke their arm, or someone who's experiencing suicidal thoughts. Does that make sense? So emergency rooms have their place, and they have their place with behavioral health crises. If someone has made a suicide attempt, they need to go to a medical facility. Absolutely. If someone is trying to avoid making a suicide attempt, they don't necessarily have to go. I'm going to explain a little bit more of that. But so really what this is about is helping you understand when you're on the phone with someone who is in a behavioral health crisis. So behavioral health is psychiatric or chemical dependency. It's the umbrella that covers both. Having this, I'm hoping will give you just a little bit of information to understand. Do I tell them just call 911? Do I tell them just to go to their local emergency room? Or can I maybe help make this a little more comfortable for them and help them find a local freestanding psych hospital? So that's what Triangle Springs falls under, the category of local, like we are a freestanding psychiatric facility. We don't have a medical hospital attached to us. We are not attached to one. So that's kind of what my outcome goals are for you today, is to have a little bit understanding in that moment. I know you're always going to be trying to make decisions. Is, do they need to call 911 and go right to the emergency room? Is there an opportunity to make this a little bit more comfortable for them and help them avoid the emergency room and go to a psychiatric hospital? Thumbs up if that makes sense, that that's kind of what our goals are. Okay. Lynn, does that make sense? All right, great. There we go. So I'm sure I know that at HopeLine, you're talking about all sorts of crises, financial crises, housing crises, you know, looking for medical attention, but I'm specifically focusing on behavioral health as an epidemic in our country. So I don't know how much you have focused on this or how much you understand the impact of the behavioral health crisis on our country currently. And I'm going to tell you, being in the trenches during these last 5 months with COVID, it is just increasing. I am sure at the HopeLine, they have seen an uptick because everyone's needle has gotten moved. If you operate a little anxious like me, then you've been operating pretty consistently anxious. Folks who were already consistently anxious have moved the needle to where their lives are being impacted and they aren't functioning like they were before. Same thing with depression. Everybody's needle is getting moved up because of these unprecedented times. Same with substance use to abuse. Everybody's needle is getting shifted, so acuity is getting higher with almost everybody. We have seen more days at occupancy or nearing occupancy in the last 5 months than we had in the previous 18-ish months that we've been open. So we just see the volume is increasing. So whatever these numbers are, is my point, is it's probably increased since March. But the truth is that 1 in 5 adults experience some symptoms of mental illness during a year. So that could be low-level anxiety. That could be debilitating panic attacks. It could be mild depression. It could be all the way to suicidal ideation. Someone may be experiencing a little psychosis, meaning that, believe me, you can be a little psychotic, where you're hearing things, but you're able to kind of rationalize it. They could be full-blown psychotic where they have no attachment to reality. So 1 in 5 adults, that is documented. So there's probably a lot of people who are not documented. So we're looking at 50 million adult Americans a year. We're not even talking about children. 1 in 10 adults, so 25 million folks, suffer from addiction. And there's a lot of gray area right before you hit that technical definition of addiction. So there's a lot of folks who are experiencing increased substance use, going to substance use to full-blown addiction. So this is all kind of spectrum stuff. Are you getting what I'm saying now? So there's lots of people on this spectrum of behavioral health struggles. And if everyone's sliding this way, not everyone, but I'm going to tell you, most people have slid a little bit towards increased symptoms. So these numbers, again, have probably risen. We know that 30% of those with addiction also suffer from mental illness. I'm sure you all have heard the term self-medicating. So there's so many people out there who are masking their mental illness with substance use or abuse, or who are treating themselves for it because they don't have access to the proper mental health. There's a lot of folks who are labeled addicts. And the reason they're addicts is because they're self-medicating and their underlying mental health addictions have, mental health issues have not yet been addressed. So that's a whole nother issue. 60% of adults with mental illness don't receive treatment, and 90% of folks suffering from addiction do not receive treatment. So if all those folks are out there not receiving treatment and everybody's sliding towards higher acuity, then you're probably going to experience a higher volume of calls with needs in these two areas as COVID is not going away and all of the restrictions and limitations because of it. So I think it's more important now than ever for you to understand what's out there and available. Anybody want to unmute themselves and ask me any questions before I move forward? Okay. So I mentioned at the beginning a little bit, I gave you this little overview of the different options if there's a mental health crisis. If someone calls you and says, I just took 50 pills, they have made a suicide attempt, they need medical attention, that is life-threatening, they need to go to the emergency room. If so an emergency room is important because the first thing that's going to happen is they're going to get medically stabilized, right? So that's if there's any sort of concern, if they say that they've cut their wrists, or if there's anything that is at all physically life-threatening in any way, they need to go to the emergency room. Conversely, with substance use and abuse, if someone says, I haven't been able to access, I've been drinking a fifth a day for 4 years and now I can't get any alcohol and I haven't had anything to drink in 3 days, they're going to need medical clearance as well. If someone's in any kind of active withdrawal, any kind of active detox, they also need to go to an emergency room. So alcohol in particular is one of the most deadly substances to withdraw from. Someone withdrawing from an opiate is going to feel like they're dying, but they do not, I'm trying not to get too deep into this, but you don't have the same physical reactions to withdrawing from an opioid as you might from alcohol and a benzo, say. But you don't get to decide that on the phone in 3 minutes. If someone is telling you that they're actively withdrawing and they cannot access what they've been taking, so their withdrawal is just going to continue, they need to go to an emergency room. They need to go get medically checked out. Most medical hospitals have psychiatric beds that are accessed through an emergency department. UNC Chapel Hill, you can't just walk in and say, I need to check in, I'm suicidal, I need to have a psychiatric stay. Even though they have multiple psychiatric units, the only way to get through them is the emergency room. All of our local hospitals either have triage psychiatric beds or treatment psychiatric beds. And again, there's a lot of differences that you don't need to know all of, but there are support staff at all of our local hospitals, most big cities' local hospitals. There's a strong support staff 24 hours a day for psychiatric. if you go into our outlying, more rural, they have partnerships. So there is at least telehealth support. So you can get straight psychiatric support through any emergency room. But again, if someone is straight up in a psychiatric crisis, if someone is actively using but would like to go get help to detox, if someone is afraid for their loved one or themselves that they're not safe, but there's no physical danger, avoiding the emergency room is good for two main reasons. One, an emergency room is going to cost you an emergency room visit. So you might go to the emergency room and they're going to say, you don't meet criteria for inpatient, but that person's still going to have to spend about $1,500 minimum just for having walked in that door. And most of the time when you go to a local hospital, even one like UNC Chapel Hill or Duke, the Big Duke, they're the only ones who have actual beds that you can be transferred from the emergency room and go do your psychiatric stay. A lot of times they're full and they're going to place you anywhere that will take that patient that has room for them. So UNC Rex does not have treatment beds. Wake Med does not have treatment beds. They assess and place folks elsewhere. Duke Regional does not, well, that's not true. Duke Regional has just or is about to open some treatment beds. But most hospitals, it's a short-term triage, then placement. If someone gets placed elsewhere, it's anywhere in the state of North Carolina that has a bed available for them. And you lose a lot of control over where you go geographically when you go in through the emergency room, because it is the responsibility of those social workers in the emergency room to make sure that the patient is placed safely somewhere and that their beds get freed up for the next person. So if they call Triangle Springs and Triangle Springs says, we can't take them, we're full today, and then they call down to Bryn Mawr, which is 3 hours away, that patient's going to Bryn Mawr and they're 3 hours away from their family. Does that make sense? That's a lot of stuff I'm throwing at you, but this is information I didn't know when I had a loved one who needed to be hospitalized for a psychiatric crisis. I didn't know when I went to the emergency room. I wish I had known this then, because it could have saved us a lot of stress and a lot of cost, right? So if you do not think a person has a medical need to go to the emergency room, it would be awesome if you could help them figure out, is there a freestanding psych hospital within 30 minutes of where you live? So I'm going to talk to you a little bit about how you can find that out in a minute, but I want you to understand what is not universally true, but mostly true for freestanding psych hospitals. One, they do usually require insurance, so private insurance or some other healthcare coverage, Medicare, Medicaid. So that is important. If this person is completely uninsured, send them to the emergency room, always. Most freestanding psych hospitals are going to require a payer source, and it is expensive for them to come in and have to try to pay out of pocket. So that is a bit of information that is good for you to know when you're making this decision as well. Most of them offer no cost assessments 24 hours a day. The two hospitals in this area are Triangle Springs and Holly Hill for adults. There's also, Holly Hill offers for ages 4 and up. And then there is another small hospital in Garner that does children, adolescents, and geriatrics. They have a big hole in the middle for adults, and that's kind of where we got our beds. So we're 18 and up. So most hospitals like those in this area, we do not charge for an assessment. If someone thinks that they may need inpatient care for psychiatric or chemical dependency, they can walk in our front door 24 hours a day and get an assessment. We are a behavioral health emergency room. So they may come in and there may be a wait. There could be a 5-minute wait and there could be a 4-hour wait, much like the emergency room, right? but they're not getting put in line behind a car accident, a gunshot wound, a heart attack. They're just getting triaged according to acuity for their mental health issues. So that usually shortens a wait time in comparison to what you're going to get in an emergency room. Most of the time, today is one of those funny exceptions at Triangle Springs, but I'll tell you, most of the time, psychiatric hospitals, freestanding psychiatric hospitals, have beds available or coming available that day. We are crisis stabilization. Most freestanding hospitals offer crisis stabilization, so people go in there for, let's say, 7 to 10 days. So every day, maybe 8, 9, 10, 12 patients come in, and every day, maybe 8, 9, 10, 12 patients leave. So there's constantly availability. We leave a little cushion for walk-in because we know the folks in the hospital, you know, we take folks from the emergency rooms all the time, but we know that they're safe, right? So we keep a couple beds open because we don't know who's going to walk in our door. And if someone who is acutely suicidal or actively detoxing needs a bed, we'd like to keep some beds available. So today is one of those days that we are operating right up against our capacity. We had 76 of our 77 beds filled this morning. We only have 3 people going home today. We have 11 people scheduled to come in for an assessment. So that's pretty tight. We won't even look at what's in the emergency rooms today. So we are only going to focus on the people who walk in our door looking for help today. Does that make sense? But this gives you some control. So those folks in the emergency room who think they want to come to Triangle Springs, we can't even look at them today. We probably can't look at them tomorrow, maybe Monday. So those ER social workers still have to get them out as quickly as possible. So they're going to have to look at what's available somewhere else in the state until Monday, probably. This is not a Triangle Springs thing. This is a freestanding psychiatric hospital protocol. We have to keep some things available in case some acuity walks in our door and we need to keep people safe. So this is where it helps. If you send someone to a freestanding hospital, they're going to have a little bit more control about where they end up. So if it's within 30 minutes of their house, then they're likely going to get to stay there. And if it wasn't COVID, their family members could come visit them. I mean, now I don't know how much it matters because everybody is doing virtual visitations across the country. No one's allowed in most hospitals anyway, but let's operate as if this is not a COVID time, right? So there are about 4 or 5 big hospital systems across this country. I'm going to give you, if you're writing this down, I want to give you the name of 3. So I work for Triangle Springs, which is under the umbrella of Springstone. Springstone is a small hospital system. Actually, we have 17 hospitals. We're the only one in North Carolina. Most of them run through the heartland of the country, and we have 1 on the West Coast. UBH, or United Behavioral Health, is who owns Holly Hill, and they're huge. There's hundreds of hospitals under their umbrella. And then another one is Strategic. So Strategic Behavioral Health, I don't have any earthly idea how many hospitals they have, but they are across the country, and they also usually are across the age span, just not here locally. So if you had an idea, I know the callers call from everywhere. So you could be talking to someone in Texas, right? Or you could be talking to someone in Vermont. So one thing you could do is look up one of those hospital systems and see if they're there. Or you could just Google that town or Google that area where that person is, or the closest big city, and see what the options are there. Is it, is there a psychiatric, you would Google behavioral health hospital or psychiatric hospital. Those would be your keywords if you were trying to help someone decide where to go. So does this make sense? I know I'm like throwing a lot of random information at you, and it all makes sense to me. So I want to make sure it makes sense to you. Lynn, am I on the right track? Okay.
Yeah, you're good.
Okay. I always need some feedback. Okay, any questions before I move on? That was a lot of information. I would love to answer any questions. So some things you can know about freestanding hospitals versus like a big hospital system. They are staffed with licensed clinicians and or a psychiatric professional 24 hours a day. Triangle Springs, for example, has someone at our front door in our intake department 24 hours a day, answering the phone, answering the door, doing assessments, and admitting people around the clock. So folks can call at 3 in the morning and they can be sent to a freestanding hospital. Most have 24/7 assessment departments. I cannot speak for all of them, but it is industry standard that there are 24-hour-a-day no-cost assessments for these freestanding hospitals. What the assessment does is, at these hospitals, is recommend an appropriate level of care. Does somebody need to be inpatient because they are a danger to themselves or others? Once that's determined, the next question is, can they come in, are they willing to, and can they be voluntary, or are they refusing treatment, but absolutely it's been determined by a clinician and then backed by a psychiatric professional that they need to be on an involuntary status? Does anybody have any questions about the difference of voluntary versus involuntary status? I mean, I think we understand what those words mean, but whether someone goes into a hospital, though, voluntarily or involuntarily, they can request to leave, no matter what their status is. In the state of North Carolina, whether they're under an IVC, an involuntary commitment, or voluntary, they still have to be cleared by a doctor before they're discharged. So you couldn't walk in today and say, I want to detox, or I'm suicidal and I need to be inpatient. And then 30 minutes later say, you know what? I've changed my mind. I don't want to be here. If you've accepted care and you've been admitted, you cannot leave until a doctor agrees with that, because people can actually go from a voluntary to an involuntary status while hospitalized, or an involuntary to a voluntary status. So once in the state of North Carolina, once you've been admitted to a psychiatric hospital, you cannot just walk out the door even under a voluntary status. So that's just maybe good information for you all to have. You have to be cleared by a doctor. So they're going to see, do they need to be inpatient? Maybe the recommendation then would be partial hospitalization, which is a day treatment program, 5 to 6 days a week. It's intensive. It's for folks who have high acuity but are not in imminent life-threatening danger to themselves or somebody else. But their life has really been derailed and they need intensive daily treatment and kind of supervision, because a lot of folks come in this PHP level and move up to inpatient, believe it or not, because they continue to fall apart. Another program that most freestanding hospitals offer is intensive outpatient. So we have also a 3-day-a-week, 3-hour-a-day program that's just more support than seeing your therapist once a week, and really working on life skills, because your life is highly impacted by either your substance use and or your psychiatric crisis at the time. So there's a lot of levels of psychiatric crisis. You are not necessarily, some of you may be, but if you are, you're not at this time acting as a licensed clinician, so you don't get to decide what level of treatment they need. So they can go in and have a licensed clinician at no cost say, you know what, you need inpatient, you need some outpatient programming, or I really think you just need to get connected to a community provider. So sometimes people come in with no support, and this is the first time they're experiencing any crisis, and we can have them leave with, based on their payer source, a handful of providers in the community who can help them with therapy, who can help them with psychiatric medication, etc. So they can just come in and get that no-cost level of care assessment and have a professional say, this is the support level we think you need with the current level of crisis you're experiencing. How do you get to these freestanding psych hospitals? You can be referred by a provider. You can come from an emergency room, but you can just walk in the door. Folks can just walk in the door. They don't have to have an appointment. It's much like it's a behavioral health emergency room. Most of the time, there's 24-hour access, and they can walk in and ask for help. And a lot of times when someone has picked up the phone to call this HopeLine, they are at a moment of desperation and crisis, but they're also at a critical crossroad where they're asking for help. So knowing that they could, in that moment, even if it's at 10 o'clock at night or 7 a.m. in the morning, walk in somewhere and take that first step to getting help, this is where it's really important for you all to know that the help is there. And in most major metropolitan areas, and even in a lot of more outlying areas, that help is there 24 hours a day. Our freestanding psych hospitals are great because they are mostly designed not just for med management and diagnosis, but folks can go there and get some real help. They are going to have 24-hour nursing supervising them. Like I mentioned, they'll be there 5 to 7 days for a psych, or 5 to 7 days is usually typical, 7 to 10 days depending on acuity. They're going to see a psychiatrist every day. They're going to have intensive group therapies every day. And at Triangle Springs and all the Springstone hospitals and a lot of other corporate hospitals across the country, these folks are going to get exposed to other types of therapies that they probably never would have been exposed to, like yoga therapy, music therapy, having a chaplain, getting their families involved. And we bring in community supports like AA and NA to get them connected back in the community. So I think there's this stigma and fear of the one flew over the cuckoo's nest kind of psychiatric hospital, but there's so many wonderful freestanding facilities out there that are warm. They offer a home-like environment. We're focusing on holistic treatment and really getting folks, not getting them to think they're at their bottom, but helping launch them at their so they're at the beginning. They're also going to have help with discharge planning. A lot of folks don't get help because they don't know where to get help. We're going to connect them to a psychiatrist, a therapist in the community, maybe a primary care provider, maybe a long-term treatment program, you know, other supports that they may need just to get their life back on track. So there's a lot of great, wonderful things that come out of inpatient treatment. I think it's really important that we start working to break the stigma. Nobody wants to go to any hospital ever, right? But if you're in excruciating pain and you think, oh my goodness, what side's my appendix on? How many of you have asked that question when you've had like terrible stomach pain? You're like, what side's my appendix on? Because we're all afraid our appendix is going to burst and we will not have gone to the emergency room in time. You know, so it's knowing when you've gotten to that point of acuity that, okay, it's time to go get help. It's time to get professional help. It's time to get the most intensive help, whether it's a physical or a behavioral health issue, and know that the outcomes of that can really be pivotal in turning somebody's life around. This is not the 1950s. Everybody does not go in the hospital and get electric shock therapy. We don't even offer it at our hospital, so I promise you that's not going to happen. We have staff psychiatrists who have small caseloads, who work per unit, you know, depending on diagnoses, and they work really hard to get people on the right medication without over-medicating them, getting them hooked up with community providers and hooked up with other ancillary treatments or just changes in their lives, like exercise, like doing yoga, meditation, looking at their diet. We have med providers that round daily. So some people are having, you know, diabetic issues or whatever, and it's not really being addressed. So that can be part of a stay. So getting people to understand that going to a psych hospital isn't the worst thing in the world. It's a place to get rapid, focused, intense treatment to help get this crisis under control so they can get their life back in order. I talked a little bit about the outpatient treatment programs. They can be done on a continuum, so folks can come in inpatient and step down through our programs, or they can come in and just do the intensive outpatient. They can come in and just do the partial hospitalization. They can come in and just do the inpatient and get stable enough to be able to step back to a community provider. Most freestanding hospitals offer this kind of continuum of care. And so when folks can come in a crisis, get stabilized, step down slowly, and get back to their regular life, then that's successful, right? So there's really a lot of positives to you know, what behavioral health and psychiatric hospitals have to offer. So just about Triangle Springs, so you know, because it's local, and I know there is a good percentage of your folks that are calling that are local. I am partial to Triangle Springs as our local hospital. I of course have to tell you that, but I really believe it. If I had a loved one who needed to be hospitalized now, I absolutely would choose Triangle Springs for my loved one with great confidence. So we are a fairly small hospital, believe it or not, with 77 adult beds. Our competitor has over 380 total beds. So, but that's across child, adolescent, adult, and geriatric. Again, we offer that 24-hour assessment. We have a licensed clinician who is able to open that front door. We do lock the front door at 10 o'clock at night and unlock it again at 7 in the morning, but there's a call box and that door can be unlocked around the clock. And we do treat, like most freestanding hospitals, not just psychiatric, but also substance abuse or chemical dependency issues. So there is a place to go get help other than, you know, if someone calls and they're like, I can't afford, I can't go to long-term treatment. I can't afford to go away for 45 days for rehab. I just need to be detoxed from this alcohol or detox from these benzos safely. That's what a lot of freestanding psychiatric hospitals do. You get medically detoxed, which means they're actually providing medication to stabilize all of the physical risks of detoxing, as well as providing some therapeutic treatment to move towards sobriety stabilization. Most people who come in for detox from us do not go to long-term treatment. You know, long-term treatment is a luxury. It's a long time and it's a lot of money, but many people who may be calling you with a substance abuse, or I don't know, Lynn, if there's a large percentage of that, but people calling in and saying, hey, I want to get off these drugs and I don't know where to turn.
We do get quite a few calls for that.
So yeah, so understanding that you can direct these folks to, you know, local freestanding psychiatric hospitals. Most of them, I would say with great confidence, also offer medical detox for patients, which is critical to recovery. If someone is detoxing, it's uncomfortable, it's painful, but it can be dangerous and deadly. So they do need medical attention. Just to quit drinking after 20 years of drinking a 12-pack of beer a day can be lethal. And folks need to get, they need to get medical attention for that. And we offer that type of we offer medical detox. They need to be supervised and monitored during that period of time. So the one thing I didn't tell you is where Triangle Springs is. So Triangle Springs, how many of you are familiar with Briar Creek or the airport in Raleigh? Okay, so the airport we're a mile from the Raleigh-Durham airport. So we are right off the 540-40 exchange. So we're very conveniently located in the Triangle. We're at the very, very back end of Briar Creek. But we are easy access to the Triangle and beyond. We have folks coming from Greensboro. We have folks coming from the Virginia border. We have folks coming from Wilmington. So you can see a little bit from the outside. Just for time's sake, I didn't put the tour in, but we're a beautiful building that was built from the ground up. We have some beautiful outdoor space, so folks get some fresh air every day, or they get to go smoke their cigarettes. That's not my favorite part, but if they're just trying to fight for their lives, they can have their nicotine if that's what they need. All of our spaces are warm and cozy. They have skylights or windows so they can see outside even if they're not outside. Our rooms are double occupancy, but they're spacious and they're super clean. We have a gym. We have wonderful food. I just say all this. I mean, I think Triangle Springs is amazing, but as an industry as a whole, the psychiatric hospitalization has changed, and it's changed to be a place of new beginnings, a place of healing, and a place of hope for people. More and more, they do not look institutionalized, but they look warm and inviting. Our lobby has a fireplace in it and a coffee machine, and we don't have any security guards or metal detectors. you know, it's you're coming in not feeling like a criminal, but like a person who's coming in to seek help. And I think that that's the trend, that if it hasn't gotten there yet, it's the trend that is growing across our country and across psychiatric hospitals. So that's really exciting for me. And I hope that, you know, 10 people at a time, I'm getting to help destigmatize inpatient and outpatient psychiatric help, as well as help increase understanding for access. So that's kind of all that I have. I threw a lot of words at you in a really short period of time. So thoughts, questions?
Got it.
Yeah, is that good? Is that helpful?
Yes. Yes, this is definitely helpful. It's a piece that I've told you before, Amy, it's a piece that had been missing from our training until the last time when you came. So I think it does help people understand, you guys to understand, you know, what it's all about. It's not as scary as people might think. And I personally have toured Triangle Springs, and everything she's saying is true. It's a beautiful place. It makes you feel very welcome. And so there are places like that, not just the concrete jungles that you might think they look like. So.
Yeah, I would encourage you to go on our website. Just go to trianglesprings.com and take our virtual tour. I think it gives you a good sense of what it looks like. And maybe as you're preparing for your shifts as volunteers, you know, answering the phones for the HopeLine, it might help you if, I don't know if Lynn, if you can give them an understanding of where you draw a lot of volume from for your calls, but it might help you to look at the different hospital systems and understand where they're located. Look at what's available in this area. Of course, it's my job. I'm a walking commercial for Triangle Springs, but I'm also going to tell you, I am a family member of multiple people who have struggled with mental illness and addiction. I have had to help hospitalize multiple loved ones over my lifetime. I am a very active volunteer with NAMI, and I would not represent Triangle Springs if I didn't believe in them as a hospital, because I feel a huge responsibility to the community of folks in our area that suffer from and live with mental illness and addiction. And so I would not represent a facility that I would not place a family member. I mean, that's just, Lynn knows a little bit enough about me to know that I live in conviction, and I absolutely wouldn't say the things I say, but there are other opportunities in this area as well. And I just encourage you to prepare yourself and educate yourself to know how to help folks, because if they're calling you, they're ready for some help. If they're calling you, they're ready to take a step. And the more you feel prepared to at least point them in the right direction. I'll tell you, recently, a friend called me from another state, and their child was experiencing a crisis, and I was able to just get on the Google, and because I know what to look for, point them away from the emergency room and to a local psych hospital I really didn't know anything about, except I could kind of tell by their website they were similar to Triangle Springs, and they offered the no-cost assessment and, you know, 24-hour option. And that's really all it took, was Googling Kansas City and, you know, seeing what was out there. So I think you don't have to, this isn't your world, so you don't have to know all of it, but I really feel like you could arm yourself with some good information for major cities or major areas that you're drawing calls from. And so you're prepared, because if you help people when they ask for help, you're literally going to be saving lives, getting them to a place that can offer them the next steps.
Absolutely.
So.
Questions, guys? You feel more educated on intake and assessment now and what it all means? Good.
All right.
Awesome. Amy, thank you so much.
Yeah.
I enjoyed your talk. I always do. So I really appreciate it. And I will definitely be in touch because
Great.
This has been a successful thing so far.
Yeah, it's wonderful. Thank you so much for having me. I feel really honored to be part of it. Again, I just appreciate all of you for taking this on, and your courage and your commitment to it. I think it's incredible. I think so much of the folks that at HopeLine and the work that they do, and just adding to the team is wonderful. So everybody, congratulations on your training and getting towards the end of it. Thank you for sharing part of your day with me, and Lynn will be in touch soon, okay?
All right, sounds good. Thank you so much.
Bye, everybody.
Take care.
Bye-bye.
Bye.
See if I can get out of here now. Hold on, I'm trying. There we go.
Did it. I love her. She's great. Okay, so we've got about 4 minutes until our next speaker. Our next speaker is actually HopeLine's executive director. So you guys are going to get to meet the me and Helen's supervisor, our head honcho and fearless leader. She hates it when we call her that. So anyway, let's take just a couple of minutes break, and let's reconvene back here right at 12:30. Okay.